Aho e whānau e Whina Plunkett. My name's Trish. I've been a Plunkett line nurse for 4 years now and primary care nurse for 12 years before that. I do believe the early years lay the foundation for health and wellness, and I'm passionate about supporting whānau and tamariki towards optimal health. And dental health is a big part of that. And I'm sure it's a topic that lots of whānau are interested in today. So kia ora to Dana and Bronnie. Could you please introduce yourselves to the whānau watching? Ngā mihi.
Kia ora, ko Dana tōku ingoa. E mahi ana au ki Be Healthy Regional Dental Service. I'm an oral health promoter for Be Healthy, which is the community oral health service for Te Whanganui-a-Tara, the Wellington region.
Kia ora everyone, I'm Bronnie and I'm an oral health therapist working at Be Healthy in Wellington at a hub based in Cannons Creek in Porirua.
Well, ngā mihi, ladies. It's lovely to have you here with us today. So whānau, thank you for tuning in. Today we'll be discussing 5 key messages for oral health in tamariki. So those are brush your teeth 2 times 2 minutes per day, and we'll talk about the brushing technique, spit, don't rinse, and chew snacks with no added sugar, drinks, milk and water, and then dental checks are free in Aotearoa for under 18 years of age. We'll also be talking about advice in managing breastfeeding when pēpi have teeth coming in, which is a subject I think a lot of mama will be keen to hear about, some tips around that, and what to do when there's an accident and tiny teeth are damaged. And then, as always, answering your pātai, your questions, so you can leave any pātai you have in the comments, and we will do our best to answer them. So to get us started, Dana or Bronnie, can you tell us about the Be Healthy mahi you do and that happens in the other regions as well?
So we see children from 2 years old through to 12. We have 12 or 13 dental vans which we take out to schools and kuras to examine the kids' teeth, and then they're booked back into the hub for treatment. So yeah, we're really into early intervention and preventing decay. Dana goes into the kindies to do checks as well, and that's really effective to catch these kids.
Yeah, so a bit of my role is prevention and education and awareness about oral health and the service. We want people to access our service. The services do differ around the different regions in Aotearoa. However, they all work quite similarly as well. So most of the time children will be seen from age 2, have a checkup each year at their local dental clinic, or possibly on a mobile dental van at school. So the process is pretty similar, other than there's a couple of minor differences. And my mahi involves going out to kohanga reo and early childcare centres, doing education and on-site dental checks, as well as getting out in the community. So that's a bit about what we do. Yeah.
Great. Oh, thank you for that. You ladies are doing wonderful mahi out there in the community. So that first key message about brushing 2 times a day for 2 minutes. Dana, could you tell us more about that?
Yeah, so it's really important to brush with a fluoride toothpaste for 2 minutes twice a day, and we want to start as young as possible. So as soon as that first tooth appears, you don't have to spend a full 2 minutes brushing one single tooth, but it's good to get into the habit of brushing morning and night. And Bronnie might touch on a bit more about why it's so important to brush our teeth.
Great.
So as soon as teeth come through, they're vulnerable to get decay. So removing the plaque, which is like the white sticky film, twice a day will be preventative. As soon as there's plaque there and it interacts with the foods that we eat. It causes an acid, and then that is what breaks down the enamel. So frequent removal of that is really protective, as well as using a fluoride toothpaste, which we will discuss.
Yeah,
Wonderful.
so I can show you if you like as well.
Wonderful, that would be great. Because I think a lot of whānau, we do get a lot of calls on Plunket Line from whānau asking when they should start brushing teeth. And, you know, knowing that you do that right from when that first little baby tooth appears is really good information for whānau watching.
Yeah, and also it's important to know what kind of toothpaste we should be using. Because there's so many different brands out there for all different age groups. So we've made up a bit of a poster with recommendations. So basically, all of your standard brands are good. What we're looking for is that the toothpaste contains 1,000 parts per million fluoride. Because what it is the fluoride in the toothpaste that's helping to protect the enamel, the outside layer of the teeth. So as you can see on the screen there, on the left-hand side, we've got all of our regular minty toothpastes that have the recommended amount of fluoride. And on the right, in the green box, are some non-minty toothpastes. So we know a lot of kids don't like the taste of mint. So there's some fruity ones, some unflavored ones. There's a whole variety there that all contain the correct amount of fluoride. And finally, in the red box down the bottom, just a few examples of toothpastes which don't contain the right amount of fluoride, or they don't contain any fluoride. So that's not really helping us quite so much. And Bronnie might touch on what fluoride actually is, because a lot of people will be wondering that.
So it's a naturally occurring substance which makes the enamel, which is the outer surface of the tooth, stronger. It helps repair early lesions, which is like very early tooth decay. If it's contained to the enamel, it can help remineralize these areas and stop it progressing into the next layer of the tooth. So once it progresses into the dentine, that's when a tooth needs treatment, generally in the form of like a filling or a crown. And also fluoride can stop the growth of bacteria in the mouth that causes tooth decay. So it is really beneficial. And just using a little smear is great for children under 6, and then a pea-size amount from them.
Okay, so just a tiny amount just to start, not only protecting that first little baby tooth that comes through, but also getting into that habit and routine of brushing teeth.
Exactly, yeah, and eventually encouraging the toothpaste to be spat out and then the mouth not to be rinsed out with water, so that fluoride is absorbed into the outer layer of this tooth surface, which provides protection.
So that was going to be my next question as to why it's so important to spit and not rinse, and you've already answered that one, I think, because I certainly didn't know that. I was brought up in the 60s, so it was all different back then. Yeah,
traditionally we have been taught to rinse with water after brushing, or even for older people using a mouthwash after brushing, but now that's changed, and so it's just spitting out and then not rinsing or not using any mouth rinse after brushing.
Okay. Well, that's really good to know. Yeah, really good to know. And it's interesting how things change over time. So that will be good advice for whānau, and they can let grandparents know as well. So food-wise, ladies, what would you recommend for tamariki and pēpi in terms of snacks and meal times and looking after their little precious teeth around food intake?
Yeah. We always say go for things that are natural whole foods. What we're looking for in regards to looking food that's good for your teeth is foods that don't have added sugar. So your standard fruit and veggies, 5+ a day, those kind of things, just keeping it simple. but also thinking about how foods are prepared. And we know that with a lot of baby foods, purees and things like that, some of them actually have added sugar in them, which can be surprising.
Wow.
For example, some of the fruit ones that are with custard, some of them have added sugar. So you just want to check the ingredients on the back to make sure that there is no sugar added.
Great. Yeah. Read the label.
Yeah.
And what about snack recommendations for snacks? Because that in between meal eating, that can be a risk for teeth as well, I believe.
We do recommend keeping snacks savoury where possible.
Okay.
Foods to look out for anything kind of high in sugar and sticky. Things like dried fruits are often marketed as really healthy, but because of their concentrated sugar and the retentive nature, they tend to stick in teeth and can be a contributing factor towards tooth decay. So snacks like popcorn, carrot sticks, hummus, boiled eggs, things like that are really great.
Awesome. And what about drinks? What would you recommend to whānau watching in terms of drinks for pēpi?
We always say you can't beat water and plain milk. That's what I was raised on, and I've done okay in regards to oral health. Water's free, and depending on what region you're in, some of our water has fluoride in it as well, which is really good to help clean the teeth in between brushing. Plain milk is going to make your bones and your teeth strong. It's really good. We would advise steering away from flavored milks or juice or anything that has added sugar, such as fizzy drink. It's got a lot of added sugar, and it can sit on the teeth and eventually damage them over time.
Yeah, and getting into that habit of drinking water, and parents can role model that too. These days there's so many cool water bottles that you can have and carry around with you, and if your pēpi and tamariki see you drinking regular water, that can be inspiring for them, because we know they love to copy what parents do. So ladies, when is the best time for little ones to start seeing a dentist?
So from 2 years old, we encourage the first checkup here at our hubs. So a lot of the time that's more of a socialisation visit, education, and just having a quick count of the teeth, and sometimes putting on a fluoride varnish as well. So that's really great. It gets them used to being in the clinic with their parent or even a sibling.
Wonderful. And what can whānau do in terms of, I know there's a little phrase I remember from when I was a primary care nurse, lifting the lip. Could you tell whānau watching about how that works?
So that comes to checking the teeth. So often decay can sit on these front teeth. So lifting the child's lip to check that they're all looking nice and healthy, and also getting the toothbrush and some fluoride toothpaste in this area as well is really beneficial, as well as reaching right to the back of the molars. We do encourage assisted brushing to around 8 years old because of this reason, until the tamariki have enough dexterity basically to tie their shoelaces is what you need to reach all the surfaces well.
Great. And I think our production team are going to put some links in the comments about how to lift the lip and do those self-checks, which are really important in between your dental checks. So as far as breastfeeding goes, and when tamariki have teeth, that's no reason to stop breastfeeding. The World Health Organization recommend breastfeeding exclusively to 6 months for optimal health, and then to 2 years and beyond. So there are some ways that you can manage the teething, and babies tend to know quite quickly not to bite when they are breastfeeding. They can get quite a lot of pain and discomfort with teething, and we're going to put some tips in the comments about how to manage that as well. There's some great tips on the Plunkett website, and there's a link to the Lalash website as well. So have a look in the comments for that. But basically, unlatching if they start to bite, or just putting them down. Try not to react, because they then can think it's a game and they think it's a bit funny and might want to do it more. So what we advise on Plunket Line is put the baby down on the ground, ignore them, and they won't like that. They'll soon learn not to bite. We do have some questions, some pātai here from Tiana Perez. Any thoughts on electric toothbrushes for a 4-year-old versus manual? So Tiana's 4-year-old will only brush if it's with an electric brush like Mama and Papa. Oh, that's so sweet. But Tiana doesn't want this to cause damage to her gums or teeth. So ladies, have you got any tips around that or advice around whether that's best or?
They can be more effective. So I think that's absolutely fine. As long as the toothbrush head is small enough to reach to the areas, and guiding the toothbrush around with a really light grip. You don't want to do like the scrubbing back and forward with an electric toothbrush, because that could cause a little bit of gum damage.
Okay, great.
Yeah, and we also want to make sure that it's a soft toothbrush head. That's what can damage the gums. Keep it nice and soft, and also renewing that toothbrush or toothbrush head each season, we say. So every 3 months, because that's when the bristles start to splay open and scratch the gums and things. Yeah.
Right. Oh, well, that's really good to know. I have another pātai here from Risha Asmakhan. Hello, can I know if we can use the normal toothpaste, which we all use for kids? My toddler is 2 years old. So I guess what this pātai is about is, can the toddler use the same toothpaste as the older children in the whānau?
Yeah, they totally can. So fluoride is safe for children and adults as long as it's used in the correct amounts. So as long as for the toddler, they're just using a half pea size or the size of a grain of rice, that should be fine. And as long as we're encouraging them to spit it out rather than swallowing it, we don't want the kids to be ingesting the toothpaste. You don't have to buy age 2 to 5 toothpaste or age 3 to 6 toothpaste. We know the kids all love the pictures on the different age toothpastes, but you are totally fine to be giving them an adult toothpaste as long as you're using the right amount. It's just the flavour's a little bit more mild in the children's ones. Yeah.
Wonderful. And Courtney has just said her baby has just got her first 2 teeth down the bottom. That's wonderful and really exciting, Courtney. And Courtney would like to know what she should use. So similar question, but for a much younger baby.
Yeah. So you can just use a small cloth to clean the teeth if a toothbrush isn't going to work well. So experimenting with that. You can also get like a little finger brush online, which they can be quite good to reach those little teeth.
Oh, good. Good to know. And Sarah has asked for any tips on breastfeeding when they get teeth. It scares me. I do really understand, having had babies myself and breastfeeding them right through to 2.5 years of age. We have got some tips in the comments, Sarah, that might help you. And we also just mentioned that just prior. Claudia wants to know if any time of day is okay. Sometimes timing goes off very easily. So what would you recommend in terms of timing?
Is it for brushing?
Yes.
I mean, ideally we do recommend after breakfast in the morning and then before bed. But if it's a challenge, any brush is great. And the priority is the brush before bed. So going to sleep with clean teeth is a priority.
Especially
and I think
sorry, Trish.
No, you carry on.
Especially if they are having a bottle. if you're giving them a bottle or milk or anything through the night, that's fine. But it's really important to start, once they get teeth, start wiping with a muslin cloth and a little bit of toothpaste, just wiping that milk off the teeth overnight, so that it's not sitting on their teeth overnight. Because in the evenings we don't produce as much saliva when we're sleeping. And the saliva helps to pretty much wash anything off the teeth alongside water. So it's really important, if you're going to give them a bottle at night time, just make sure you wipe that milk off their teeth after, and if possible, bottle before bed and then brushing after that. So toothbrushing to be the last thing before bedtime if possible. Yeah.
Really good to know. And it does fit around that routine. The more we know that babies and toddlers love familiarity and repetition.
Yeah.
So the more we can do things at the same time of day in a similar way, and also letting them know what's coming. We're going to brush our teeth soon, get ready for it. Then they know what's coming up and what to expect. So another part I hear from Natalie, my baby just has one tooth that's only just erupted. Exciting. Do we brush the part of the tooth that we can see, or wait until it's come up more? That's a great, really great partai.
Yep, probably. If it's only just visible, it would probably be hard to clean. But once it's up a little bit, it would be good just to clean it slightly with a muslin cloth. But it will get easier as it erupts further into the mouth. So not to worry about it too much. Yeah.
Great advice. Oh, wonderful. Thank you so much, ladies. So thank you, Dana and Bronnie, for your expertise, and thank you to everyone watching and commenting. We've had some great questions today. Do you have any other tips you want to share before we wrap up the talk?
I think just that it's really important to get enrolled with an oral health service.
Right.
Although we are a national service, and it is regional, so your child will be automatically enrolled by the midwife when they're born, if they are born in that region. Otherwise, if you move, it's really important to give us a ring on 0800 Talk Teeth and make sure that you get them enrolled so that they can be getting their free dental checks. If you have any concerns before they are age 2, feel free to give us a ring. We can give advice over the phone or book them in for an appointment at the clinic before they're 2 years old. That's totally fine as well. And the other thing to note is we know that children have accidents. Accidents are common, and teeth getting chipped or knocked is also really common. So our advice regarding tooth-related injuries would be to register with ACC. Whether you go to a private dentist to register or your GP, the after hours, just to get that form filled out. It's really important because it will cover the adult teeth when they come through as well. With ACC, there can be a part charge or a co-payment required sometimes, but you can discuss that with the dentist that you're seeing. But yeah, just really important, even if you only think it's a minor chip, get them registered with ACC so that it's covered. Yeah.
Well, that's wonderful advice. So wonderful, ladies. We've got a lot of really good tips there that whānau can add into their kete of knowledge around little teeth. So thank you for joining us today. Anything else you want to say to sign off, ladies?
Thank you, Trish.
Yeah, thanks for having us. It was great. And if you've got any questions, send them through. We might share some of our resources with Plunkett as well so that you can flick through at a later date, and check out our website, which we'll send you the link to as well. That's got some awesome oral health and nutrition videos and some tips and tricks on there too. Yeah.
Oh, that's great. Thank you so much, Dana and Bronnie. Ka kite.
Thanks for having us.
Thank you.
Ka kite, kia pai tō rā.
Mā te wā.